And there's also a lot of recommendations in terms of coordinating within departments and developing a department level plan. So I'll let that document pretty much stand on its own, but I did want to talk about two different things that are covered in that document. And one is one of the fundamental frameworks that was used in the development of that document in terms of the CDC's hierarchy of controls. And the second thing I wanted to talk about was providing additional student support and support to lab members in this challenging time as well. So one of the biggest challenges was with this is figuring out how to continue to operate in our research laboratories during a pandemic when the risks associated with COVID-19 are so much higher than those risks that we generally accept in our everyday life from, say, driving a car or walking around outside. I pulled this off New York Times yesterday, but as of that time, there were 4.6 million known cases in the United States and over 150,000 deaths, and these may be an undercount. So it's really a question of can we and how could we safely continue to operate in our research laboratories during this really challenging time. The really great thing about running a research laboratory is that it is a situation where a lot of laboratory work can be done with social distancing measures in place. So this is a picture, and oftentimes people will think of a laboratory environment as potentially a lonely place, which actually in this case can work to our benefit. So it was really important to figure out, can we safely resume these research operations while maintaining a high level of safety? And thinking about what are the trade-offs that we need to make and what can we prioritize in terms of reopening our research laboratories. So the first thing that I wanted to talk about was the CDC's hierarchy of controls. And this is a framework that's often used in occupational health settings when we have a hazard that we need to control. And you can see on the left that these 5 different things that you can do are ranked from most effective to least effective here. And the goal is really to keep the hazard away from people as much as possible. I also wanted to note that different levels of this framework can be used at the same time. So you might use some of these in conjunction with other ideas. So the first 2 levels of this framework include elimination and substitution in terms of controlling the hazard. And these are really ways to completely remove the hazard from the person entirely. So in the case of COVID-19, what we've done a lot in terms of elimination and substitution are encouraging people to work from home as much as possible, or in the case of substitution, maybe changing a project that was going to be done in the laboratory to be a remote analysis, if at all possible. So this is the safest thing that we can do, and it's important to encourage this in any case where we can do this for meetings and other work that can be done entirely remotely. It is the safest thing, but not everything can be done entirely remotely. It's not always going to be possible to do what we need to do in our research laboratories to move important projects forward entirely from home. The next level on this hierarchy is engineering controls. So this includes things like increasing ventilation rates, setting up different patterns as people move throughout the building to avoid contact with each other, cleaning surfaces. And this is really trying to isolate those people from the hazard. And you're trying to control the hazard a little bit further away from people still. So this is definitely something that needs to be in place, and you've probably heard of a lot of efforts at the university level to try to implement new engineering controls to control this hazard. The 4th level down is administrative controls, and this includes changing how people work. So it might include additional workplace training as well as workplace scheduling. And workplace scheduling can work well here to make sure that we have a smaller number of people in a laboratory at the same time compared to what we may have had in the past. So working different schedules, as well as the trainings that have been available at the university level to make sure people are aware of the hazard and what they can do to mitigate it. Finally, the last level of this hierarchy, and actually the least effective, is personal protective equipment. And the reason that this is at the low end of this is because at this point, you're really controlling the hazard when it's already made it to the person potentially. So it's really important to use personal protective equipment in conjunction with these other measures whenever possible. A lot of you have been probably paying attention to the mask debate that's gone on since March. And masks are definitely a really critical component of controlling this particular hazard, but they are not perfect. And so it's really important that we don't use this as our first line of defense. We want to use it, and it's really critically important that we do use personal protective equipment, but we need to do it in conjunction with other measures. So once again, you can use multiple levels of this hierarchy. So I wanted to talk about this today because I think it's really important when people are developing individualized plans to come back to this framework and think about trying to be on the most effective end of this framework that you possibly can, while still doing what you need to do in your laboratory to keep everybody safe. So the second thing that I wanted to talk about is also one of the priority areas, one of the guiding principles that we talked about in this document that came from the research recovery meeting was principle number 3, which was protecting the careers of early researchers, especially including graduate students and potentially other members of the research community. So I think this is especially relevant now as we're going into the fall semester, to be thinking about our students and other laboratory members who might be experiencing a very high level of stress during this pandemic. So in this paper, they said about a quarter of college students were experiencing clinically measurable anxiety symptoms. And this can result from isolation, fear, uncertainty, boredom. You know, they're stuck in their house for 24 hours a day for extended periods of time, and perceived or real reduced career prospects in the future, and a lot of other things going on. So I wanted to take a step back and help us all remember that our students might be under really high levels of stress. And there are some things that we can do in this uncertain time when everything is changing to help support them and to help move research forward as best as possible. So these are the 4 things that came to mind when I was thinking about this, and I'd actually love to hear from everyone else in the discussion time about other ideas and ways to potentially to provide additional support in this time to students and laboratory members under these changing circumstances. So the first thing to consider is ensure that you have clear and frequent communication with your students. The second thing is to outline a goals document with a timeline that you can update regularly to keep everyone on the same page. The third is encourage opportunities for students to connect with other students. And this, I'm using students here, but this also potentially applies to postdocs and other laboratory members. And finally, also incorporate opportunities to continue to discuss non-project related topics. So one thing I've been thinking about in my research group is to make sure that we're trying not to operate in a disaster mode mentality. And what I mean by this is that when this crisis initially happened around March, everything was changing, people were really worried, and we were mostly spinning our wheels and not really able to move our research projects forward. And so I think it's really important that we try not to operate in that disaster mode mentality. We try to sort of calm down, make sure we're thinking about the broader picture and moving things forward. And so that might mean taking a break, you know, an extra break here and there, make sure everyone is taking care of themselves. So in terms of the first thing I talked about, clear and frequent communication, just making sure that everybody's still having regular lab meetings weekly or bi-weekly or whatever your required frequency is. And also that during these meetings, you're outlining clear and specific expectations, because these expectations might have changed given the current situation. It's also really important that students can continue to understand why their work is important in the broader context, so that they can remain motivated and they see why what they're doing on a day-to-day basis is broadly important. So I think being very clear about what your expectations are, you know, not necessarily micromanaging, but giving specific expectations about in terms of what needs to be completed, when it needs to be completed, and making sure students have time to ask questions about any of that. The second thing I wanted to talk about was the importance of actually writing down goals. And I know many people commonly do this, but thinking about goals specifically in the time of COVID-19, outlining both short-term and long-term goals and making sure students understand how those goals are going to be linked to long-term career goals and skill development for when they eventually enter the workforce. This document should have a timeline to achieve these goals and ideally even a week-by-week breakdown of what should be done. And it might need to be modified on a regular basis because things are continually changing. So I added some things here that are in the goals document that I have used with my students during this time. I first wanted them to list the major research goals. So these kind of like the big picture goals. What do you want to have done by the time you graduate? And also make sure that they can connect these goals to what they ultimately want to do in their career. What skills do they want to develop? And also, how would you know that you have developed these skills? So thinking about those big picture items, even in the current crisis time, and making sure they're still taking steps to be where they want to be and also to move the bigger research projects forward. I couple this with a typically semester-long action plan, so about 14 weeks plus or minus depending on your time frame, but thinking about specific action items that need to be completed each week and how these ultimately relate to these goals. And I think it's really important for students to complete this type of document that can be modified to fit any research program, and then talk with their PI about it to make sure everybody's on the same page and we can have those clear and specific expectations. And I always tell students, aim really high with this, shoot for the stars, but if it needs to be updated, it needs to be updated. Sometimes experiments don't work. Sometimes things take longer than you think they will, but as long as we're moving in the right direction, it's a great thing to have this as given that direction, it can be modified as needed. Third, I think one thing that we've lost in this pandemic is really the opportunity for students to connect with each other. So I think it's really important that research groups can use GroupMe or other apps to continue to connect with each other and text each other as things come up. I also try to encourage my students to help each other with projects. Oftentimes this would naturally happen in the lab if two people are there and one is, hey, I don't know how to do this, and the other student says, hey, I already know how to run that, or let me show you. So I'll often still try to send students to each other to maintain that connection. There's also a lot of virtual student events that they can potentially participate in still. And one idea that another faculty member brought up was the potential for a buddy system. So on a rotating basis, pairing two students to each other to just have a check-in each week. Hey, how's it going? How's everything going? Making sure everything's okay. And just encouraging these connections to continue into the future. Finally, I think it's also really important to continue to have a extra time at the end of meetings to discuss career goals and to discuss other topics that might come up. I feel like I learn a lot about my students and sometimes even about other things going on in the lab that are really important that I need to know about during these types of discussions. So maybe it's, even 5-10 minutes at the end of a regular scheduled meeting. Hey, how's it going? Are you still thinking about, that career goal you talked about with me before? Or, sometimes you find out, hey, something in the lab was broken and no one had mentioned it yet and I didn't know about it. So now we can work to fix that or make some aspect of life easier for the students. It can be simple things like making sure they have a place to put their water bottles because all of that changed with the current situation. So I just wanted to highlight these two aspects of laboratory reopening during my time today. I didn't have time to necessarily go through that entire research document, but hopefully everybody has had a chance to read that and think about how to implement it in their own groups. But I just wanted to highlight these two things. One is the hierarchy of controls, which is a really useful framework to think about controlling these hazards in a given situation and think about prioritizing keeping people as safe as possible. And then also thinking about connecting with our students and providing those clear and consistent expectations, which I think are especially important now, given everything that has changed. And I think that can help everybody move a little bit out of this sort of disaster mode mindset and prevent people from just spinning their wheels and helping everybody move forward. So I definitely like to acknowledge my great research group. This picture was taken pre-COVID, but it's great working with everybody and of course the funders that let us do our work. And after the next presentation, I'm happy to take any questions. So thank you for listening to me today.
Thank you, Karen. And now we will turn the floor over to Dr. Oltz. He is a professor in the Department of Microbial Infection and Immunity in the College of Medicine.
Okay, hopefully everyone can see the slides. That
looks good.
Okay, good, excellent. Well, thanks, Stuart, and I want to begin by echoing Karen for how honored I was to serve on the University Research Recovery Committee. I think we put together a really great document that hopefully everyone's had a chance to look at. And I also want to thank Karen very much for the hierarchy of controls, presenting that. And it does, as you'll see from what I'm going to go over, serve as an incredible framework from which we can tailor documents, guidelines for returning to research as safely as possible within our own departments, within our own spaces. Who knows better than ourselves what particular needs we have in terms of department, the space layout, the equipment that needs to be employed, and the people that are in our departmental communities. So that's exactly what I'm going to talk with you about today, is how our department cracked this nut. It was really the fruits of many hours of discussion, labor. We had a departmental committee, Return to Research Committee. We also had at least 3 town halls, if I remember correctly, discussing but also refining the plans that we were developing as a team. And so what I've done is I've distilled all this down to highlight where we landed as a department and how we're dealing with the hierarchy of controls on some more specific levels. And like everything during this pandemic, the plan keeps evolving. But what I will tell you is that so far it's gone pretty smoothly, knock wood. There have been a couple of glitches, but that's to be expected. So big picture, just like in the Research Recovery Committee, what I think you need to do, and the reason we've had so many town meetings about just this topic, is it's clear that we need to make it clear to everyone in our community that we might only get one chance to do this the right way. And so if we don't do it the right way, there will be consequences. Perhaps things will get so out of control on a given floor or in a department that we'll have to return to the restrictions that we had before we returned to research. We also developed our own guidelines, which are, you'll see, layered under the College of Medicine and the university guidelines. So we have our own specific approaches, and there are multiple tiers to this approach. People require approval to go back to research. They have to sign agreements. There's scheduling, very important part of this, monitoring, and accountability. So we're following all the general guidelines, of course. I probably don't need to repeat these, but it's worth repeating in your town halls and communicating to your research community that any activities that can be done off-site should be done off-site and still count as work. All of our personnel have to complete the CBLs, the computer-based learning modules, before they can come back to the lab. Now we have to also repeat the Buckeye Pledge or complete the Buckeye Pledge. We require masks at all times on our floor. And of course, we can't monitor the meticulous hand hygiene, but we can stress it. We also require social distancing at all times, with the exception of now we're going to introduce training of rotating students and new personnel. In that, we require not just a mask, but we're also going to require face shields when people can't socially distance. And I stress again and again at every town meeting at the beginning and end that we expect everyone here to be responsible, not just when they're at work, but outside of work, so that we can come to work and hopefully not bring COVID-19 with us. And the last point is that we can strongly encourage people to follow these health guidelines, especially if they have comorbidities or health risks. But it's the individual's choice, and all we can do is inform them so that they make the best decisions. So this is these are general guidelines, but we've layered, as I said, on top of these guidelines, some microbial infection and immunity, which is our department. I forgot to mention that in the beginning. MI&I guidelines. So if somebody in our department tests positive, they have and they will continue to as we move forward, like every department. If somebody tests positive for COVID-19, they either have to wait 28 days before returning, which is longer than probably most places, and be asymptomatic, obviously, or they have to have a negative COVID-19 PCR test before returning to work. And I would stress PCR tests, not rapid antibody tests. People can test positively for PCR and negatively for antibodies, depending on the timing and severity of the symptoms. So this is something that's very important to stress to your people. So we also, like with every department, you cannot come to work sick, or if anybody in your household is sick. And if you've been knowingly exposed to someone with COVID-19, until you have had a PCR test and have tested negative. And like everywhere else, you have to take your temperature every day and report it before coming to work. We're fortunate, we do have a temperature and symptom check station down in the first floor of our building. But if you do test positive for COVID-19, you have to inform your PI, your group leader, but also me as the chair of the department. And I stress to everyone that this has to be, we stress to everyone that this information will be held in confidence. It will be only reported to EHS and the leadership, and will be used for contact tracing. It's important to tell people in your groups that they shouldn't, especially the PIs, that they should not go back and tell their whole community or their whole group that somebody is tested positive. That's confidential information, and EHS will handle that. In our department, we require a number of steps. Like I said, I'll go through these pretty quickly. But even if you'd been, for our department, there were a number of people who were already approved for COVID-related projects. But even if they were, they had to get additional approval to return to do non-COVID research. We had an application form that we developed ourselves, the committee, and it included some of the information that is shown here in terms of the names, planning for how you were going to schedule, logging in, logging out, which we'll get to a little bit more in a few slides. And the application had to be approved, sometimes after several revisions if people didn't take it quite as seriously as we wanted them to. And then the approved application had to be distributed to all members of their laboratory. Once it was approved, we would send to the people that were listed on the application, we would send them our College of Medicine and MI&I guidelines. We asked them to read thoroughly and then sign an attestation. Actually, they had to sign two. They had to sign the College of Medicine's attestation, but also our compliance agreement that at the time, anyway, let us know that they were returning to work voluntarily. And it also confirmed that they would report any violations of the guidelines to several individuals that in a confidential manner. So in order to schedule and to maintain safety within the laboratories, each lab was assigned or designated a research administrator. It could be the PI, or as I said, it could be a designate, maybe it's the lab manager. And all of the experiments we expect every day, not just these days, to be prioritized and approved by the PI, but it's even more important these days. We limit the number of hours per week by any individual. We try to keep everyone here for less than 6 hours per day and not to exceed 32 hours per week. There are some exceptions if there are long experiments that are planned, but they require written approval from me as the chair. And then each research administrator does all of the scheduling, trying to, and we'll go over this very briefly on the next slide, to ensure spacing between people who are in, equipment use for in procedure rooms, and this requires a lot of back and forth between the research administrator and the various people in their lab to come up with the weekly lab schedule. And in the end, the plan that we came up with, which we're now refining, was that we, instead of saying there could only be so many people per square feet, which is difficult to judge, a little more cumbersome to really keep track of, we asked that nobody schedule more than one person per bay. So if one person were scheduled in this bay as shown here, the other 3 benches or seats were out. And in the beginning, we didn't allow scheduling of people in adjacent bays that were facing that person. So this bay would have been the next one that was allowed. We are now moving, since it is 6, these in our department, these are more than 6 feet apart. We're now moving to allow scheduling in adjacent bays where people are facing each other, but still not more than one person within the same bay. So the scheduling and coordination, it takes a lot of back and forth, like I said. We also ask that the research administrators from adjacent laboratories communicate with each other to avoid overcrowding. We still exclude in-person meetings. The scheduling is done for the coming week and must be posted on a communal Google Sheets no later than Sunday noon. And then my assistant, Monday morning, sends out a list to the entire department of the people who are scheduled for that week. And then if you've forgotten to schedule yourself for that week, you are not allowed to work that week. We ask that people try to maintain a buddy system so that at least 2 people are, for obvious safety reasons, 2 people are on the floor in a given shift. And people have to sign up in advance for shared spaces, the procedure rooms that we ask in the beginning anyway, that these procedure rooms be limited to a single individual at a time. And of course, everyone is required before they start work and after they finish work to clean every space, to disinfect every space with 70% ethanol or bleach if appropriate. And finally, we've been very diligent about monitoring, tracking people. This comes in handy in case somebody is reported as a positive, which is going to continue happening, probably more so in the coming weeks with the return of a lot more people to campus. But we have people track their hours, not just in lab, but outside of lab. And we've also created another Google form in which your arrival and departure and the places that you visit are time-stamped so that we can cross-check. We not every day, but we do spot checking of the schedules and the logs. And for this purpose, to make it as convenient as possible, we do have an arrival and a departure form. Again, this creates a timestamp once you've completed it on our login and log out page to which the leadership has access. And this is just an example of the scheduling sheet that people have to fill out every week by noon on Sunday. We've listed all of the spaces, all of the benches, all of the rooms, and each research administrator will schedule accordingly. To make it even more convenient, as you get off the elevator on our floor, we have QR codes printed out that you can just take your phone and it will take you to the check-in and check-out pages, etc. All of those pages that I mentioned before. So with that, of course, there's accountability. I've mentioned most of these points before, but it's as I mentioned, it's really critical to keep going over these things in town hall meetings, in departmental meetings, in lab meetings, so that people get used to working even in a pandemic and forget some of the important guidelines. So it's really nice to just keep reminding people of how serious this is and how we want to do it the right way. So that's just the nutshell of the approaches we're taking in MI&I based on the framework that Karen mentioned, the hierarchy of controls. Thank you.
Thank you very much. And so now is the time that you all have questions about how these concepts and ideas might be applied in your areas. The questions or concerns that you have, please bring them forward.
I was wondering if anyone on the call had reopened their human subjects research lab and done any in-person data collection. We personally are still waiting for approval, so it would be nice if there was anyone who was doing it and had some examples.
I didn't quite understand the whole question. I don't know if it's for me or.
It looks like your lab is just doing basic science. I was wondering if anyone was doing, or bench science. I was wondering if anyone had reopened to in-person human subjects research.
Well, we do have, we did have to create SOPs because we do blood draws in our department. And so we created a new SOP with face shields and temperature checks, etc., so that they could be done safely. But no, we're not doing a whole lot of human subject research one-on-one for any extended periods of time. But the College of Medicine did come up with good guidelines and they are also in the university return to research document.
I only do, I do human subjects research, but my projects were actually at a phase where we were kind of in a break and we're planning to restart later in the fall. So unfortunately, I don't have any specific examples, but I'd also love to hear from other people on the call to what they have done. We've just been talking about protocols, but we haven't actually implemented anything yet.
Yeah. Okay, here's a question. Oh, please go on.
Well, and I was just going to say, as part of our SOP for the blood draws, one of the requirements is that they, the volunteer who's giving blood has to email me to assure me that they're doing it voluntarily.
The question here, an attendee notes that the protocols and procedures that you outlined, Dr. Oltz, are different from what they do in the DHLRI and internal medicine is done. So the question is how different departments and colleges are handling these rules and guidelines. Why are there not consistent guidelines across the institution?
That's a great question. I tried to stress that we do follow the College of Medicine guidelines and the university guidelines, but we layer on top of that our own guidelines. And that's largely because, as I said, we know our own space and we know our own people and we know the types of experiments we're doing. So we've tailored a little bit more. And in the beginning, we added multiple layers to be multiple extra layers to be as safe as possible. Because like I said, we didn't want to get 2 weeks in and have to back out again. And so far, again, knock wood, that's worked, and we're beginning to slowly relax some of the requirements. For example, we started out at 24 hours max per week, and we've now gone to 32. And we're, as of later this week, will be allowing more than one person in a procedure room if they can do it safely and with face shields.
One thing that I gleaned from being on the committee as well that developed these guidelines was actually how diverse our university is. And there was actually a lot of discussion on the committee about very specific guidelines and how detailed they needed to be at the university level. And so one of the really critical pieces of the guidelines is developing these department level plans to address the unique needs of every individual department. But it was really interesting to talk with people across the whole university from dance and veterinary medicine and all of these different areas that all have unique challenges to the current situation. And so the goal of the guidelines at the university level was really to provide this foundational framework with critical pieces, but allow each department to work within that framework to address individual concerns that would happen at the departmental level.
That relates to this another comment here that the person writes, my understanding is there's no specific guidance yet from Central Campus on non-distance, less than 6 feet research work as would be necessary for training situations. Has this changed? It seems your department is moving forward with such training.
Yeah, and this is through also with guidance from the graduate graduate programs. So the graduate programs, at least in the college that are primarily in the College of Medicine, are allowing their students to do rotations, in-lab rotations now. And clearly there has to be some safety guidelines in place to allow for training. And, you know, besides having face shields, so all labs are going to have to provide face shields for all of their lab members and for any trainees, any rotation students. In addition to masks, they'll be wearing face shields and masks. We request, obviously, that any training time that can be done while maintaining social distancing be done that way. So we're also talking with people about making videos to help with distance training.
Have you been able to open up all the laboratories? Is everybody able to get in and do research, or you had to, because of the limiting in numbers, prioritize some research over others?
Yeah, we've been able to do it and been able to maintain the distancing requirements that we have. Yeah.
Same in my department. We've been able to do it and get everybody in there who needs to do that. Maybe the one exception is undergraduate researchers who have not been able to get back yet. And some of that is also the training restrictions. So more experienced undergraduates who have already been trained may be able to get back into the lab a little bit earlier than someone who's, say, just starting out. And I think we'll need to hopefully look for further guidance from the university in the fall about undergraduate research and continuing that. I know that's a pretty important component of our group. We have a good mix of graduate students and undergraduates. So that's something that I'm looking for in the fall too.
PI asked the following: has there been any discussion about random or routine mandatory COVID-19 testing of lab staff in wet labs? I ask on behalf of my grad students who expressed to me fear that an individual may have had a positive test but not report.
Karen, do you want to either I can either
Yeah,
way.
I haven't heard of anything related to that. I know that the university is still looking to ramp up efforts and figure out what testing capacity might be. I think that that might be a good idea, but I think we also need to try to develop a culture of trust, and as you know, as Jean was saying, emphasize the importance that we're all in this together. We all need to be responsible and report these things. I mean, so I think that there's two different potential issues there. One is we need to make sure that we can trust everybody to work together and report something even if they don't want to, and make sure that we're open to that information, that we are receptive to that, that it, you know, we tell them it's okay if you need to report to me that you might have this, you know, we'll work through it together. And also, I'm not sure at the university level what the testing capacity is going to be.
Yeah, and I agree. We have to, at least to some extent, just like in everything, even in science, you have to have at least some degree of trust that people are going to act properly. And you know, one of the reasons that we have timestamps for people coming in and out is even when people report, we can go back and try to trace who was there and what you know, and what spaces the people were in. So if somebody didn't report and we became a micro hotspot, we might be able to garner, you know, deduce some information from the schedules that we've kept. Overall, the overarching thing is definitely trust, though.
Other questions, comments, please send those in. I know some labs have been focusing on shift work, you know, 5 a.m. to 2 p.m. shift and a 2 p.m. to 7 or 8 shift, and others, people coming in every other day, and then this group comes in the other day. I suppose in both your departments, you've had people experiencing kind of both those sort of methodologies.
Yeah, I'd say that we've definitely had people with different scheduling strategies, and I think it really depends on the research being done and what the time requirements are. So some experiments just take a long time. You know, that might be an 8+ hour experiment that's, you know, you have a couple incubations in there, and it's just going to take that long. So I think that the different schedules, that's one of the reasons it's so important to have a departmental level plan, because the time schedules are going to need to vary based on each department and what the experimental needs are. But yeah, I've heard of a lot of different strategies, people working early, people working late, having shifts, having the every other day. And I think it's really just important to think about what those trade-offs are for any given group, to see how you can get the experiments that you need to get done while maintaining the necessary occupancy levels.
Yeah, we discussed the idea of straight shifts, but we discarded it pretty quickly. We needed something that was a little more flexible, because one day you might need to work in the afternoon if you need to incubate something for 36 hours as opposed to in the morning. And people can, you know, trade shifts on given days, but it just became even more cumbersome to do it that way. And then if you're doing straight shifts, we couldn't think of a way of doing it without people having night shifts. And then there are other safety concerns if you have people parking somewhere and walking into campus at night and such. So.
Yeah, I think the flexibility that's kind of built into some, like the hierarchy of control and just the approach to doing things, and that the universities allow that flexibility has been an important point. Are there other examples of other people's laboratories are working? Who in the audience might have?
I'm sorry?
I just wonder if anybody in the audience has any other examples of how their lab is working. Do you have any other?
I know that we just hired a number of new faculty, and some of them are coming from the West Coast and Seattle, which was an original hot spot. And then they, because they got it under control, could return to research probably at least a month or two before we. And they were doing more of the shift work. They were allowing people to come in for 4 hours a day and trade shifts if they needed to. But it was really strict. You were there for 4 hours or less. Yeah.
I think one thing too is also just in thinking about the hierarchy of controls, to emphasize again that masks are not a silver bullet. And that they're really important. And I think that some people think about, okay, as long as I'm wearing a mask, it's okay, but they're not perfect. And so that we need to rely heavily on these other levels as much as we possibly can. And then also use masks to reduce risk even further. But I know a lot of people sometimes are often surprised in this current situation to see the hierarchy of controls and see personal protective equipment way down at the bottom as the least effective item. But I think it's a really important component of the framework.
Which is why we're having this meeting via Zoom rather than a room wearing masks.
Yeah, absolutely.
Well, are there any other questions that people have? It's a good chance to talk to the experts.
Nobody's really an expert at this.
Well, you're expert experimenters and process designers. I think you've been very inventive in designing a process to get through this unusual situation.
Let me just stress one more time the importance of the testing and distinguishing the tests. That a PCR test is what people need to get done. Test for the virus, not for antibodies. So there are all these quick tests out there that at Walgreens and places like that you can go and get tested for antibodies. That does not tell you anything. So we have examples of people on campus who tested negative for antibodies and then 3 days later got their PCR results and they were positive. So it takes a while for the antibodies to build up in your system. So usually it takes at least 2 weeks after you're infected. And if you're asymptomatic, you may never seroconvert, as we call it, and get detectable levels of antibodies. But you could still, you are still can infect other people because you have infectious virus.
Good point. That raises, someone says, that seems like all the more reason to be testing people in the labs. Why not do pooled testing of floors?
They're talking about it. Right now, the pooled tests haven't really, they're doing the optimization of those, but there have been a few too many false negatives when you pool multiple samples in which one is positive. And so they're trying to really hammer out the kinks in that before they move forward. And it's really probably not feasible at this point to do individual tests. We just don't have the throughput to do it. Yeah, Kristen, I love the idea too. Hopefully we'll be there soon.
I agree, it'd be great.
Well, I want to thank everyone for attending today. This program was recorded and will be posted in the coming days on the CCS website, as will the slides from the presenters and links to other resources that were mentioned. I'll let you know when all that's available. And also look for a short evaluation of this program to come to your inbox probably tomorrow morning. We'd like to have your feedback here at the CCTS on our programs, make sure that we're providing effective and programming and programming that's important to you. So again, thank you, Karen and Jean, for taking the time to speak to us on your presentations. Thanks to those of you who attended for your questions. And,
Thank you so much for having me. It's really an honor to be here.
Yes, thanks everyone.
Stay healthy, everyone.